Senator Sanders, I'm going to stay on this topic, on the culinary, on this issue with the culinary union. Obviously, their leaders are warning their members about that your health care plan will take away their health care plan, take away private insurance completely. There are some Democrats who like you a lot, but worry that this plan, Medicare for All, is going to take away private insurance and that it goes too far. Are they right?
No. Let me be very clear. 2 points. For 100 years, from Teddy Roosevelt to Barack Obama, this country has been talking about the need to guarantee health care for all people. And yet today, despite spending twice as much per capita, Chuck, twice as much as any other major country on earth, we got 87 million who are uninsured or underinsured. We got over 60,000 people who die every year because they don't get to a doctor on time. We're getting ripped off outrageously by the greed and corruption of the pharmaceutical industry, which in some cases charges us 10 times more for the same drugs because of their price fixing. 500,000 people go bankrupt every year because they can't afford medical bills. So let me be very clear to my good friends in the Culinary Workers Union, a great union. I will never sign a bill that will reduce the health care benefits they have. We will only expand it for them, for every union in America, and for the working class of this country.
Senator Warren, you were...
That's very powerful statement. Not only debunking all the stupid talking points, coming across from other candidates, but also laying it out like, what exactly he would do. He would not sign on any law or bill which gonna limit down their existing medical plan. In fact, he's proposing a plan which will expand their medical benefits.
All in on Medicare for All, and then you have since came up with a transition plan. Is it because of the impact on unions?
So I want to be clear. I've been to the culinary unions, healthcare facilities. They're terrific. You don't want to shut them down. You want to expand them. You want to see them all across Nevada and all across this country. But we need to get everybody's healthcare plan out here. Mayor Buttigieg really has a slogan that was thought up by his consultants to paper over a thin version of a plan that would leave millions of people unable to afford their health care. It's not a plan, it's a PowerPoint. And Amy's plan is even less. It's like a Post-it note, insert plan here. Bernie has started very much, has a good start, but instead of expanding and bringing in more people to help, instead his campaign relentlessly attacks everyone who asks a question or tries to fill in details about how to actually make this work. And then his own advisors say, probably won't happen anyway. Look, healthcare is a crisis in this country. My approach to this is we need as much help for as many people as quickly as possible and bring in as many supporters as we can. And if we don't get it all the first time, take the win and come back into the fight to ask for more. I promise,
guys, I'm going to get everybody in. I got you. Mayor.
Okay, Elizabeth Warren, you had a good point when you made about Buttigieg and Amy Klobuchar, because at least Buttigieg's plan, I don't know what Amy Klobuchar stand for, to be honest, but Buttigieg has very disingenuous plan. He just adopted the name Medicare for All, and who want it? Like, wait, what? Why do you say Medicare for All if you want to say who wants it? It's not Medicare for All then. But when it comes to Bernie, you don't have any substantial criticism. So all you have to say is make up some random shit. And that's exactly what you did. You could have stayed in the top tier if you would have just stood by on Medicare for All, which you did not, and you can see what happened to your campaign. But now you're just making a lame argument against Bernie. And to be honest, I'm coming from a biased point of view, obviously, because out of all the candidates up there, I am in favor of Bernie Sanders becoming a president. So I'm definitely biased towards that. But if you just listen to what she said, she doesn't have any strong criticism against Bernie to begin with.
Instead, his campaign relentlessly people unable. And Bernie has started very much, has a good start, but instead of expanding and bringing in more people to help, instead his campaign relentlessly attacks everyone who asks a question or tries to fill in details about how to actually make this work. And
she don't have any criticism of Bernie's plan. She's just making a lame argument that his campaign, instead of bringing people in like her campaign did, bringing Obama's and Clinton's people in, Bernie campaign isn't doing it, and they're attacking people. No, they're not. It's probably just pointing out to the same old bullshit of Bernie bros, and attacking some bots or some Twitter accounts, attacking the Twitter accounts of unions. So that's what she's implying there. So she definitely don't have any criticism against Bernie's plan. So she have to come up with like some sort of lame argument.
then his own advisors say, probably won't happen anyway. Look, healthcare is
Nobody knows which advisor she's talking about.
crisis in this country. We need and bring in as many supporters as we can. And if we don't get it all,
I promise, guys, I'm going to get everybody in. I got you. Mayor Buttigieg, I think she name-checked you first. I'll let you go first.
She name-checked me second.
Yes, okay. I think Amy said.
I'm more of a Microsoft Word guy, and if you look at my plan, I don't know if there are any PowerPoints on it, but you can definitely find the document on PeteForAmerica.com, and you'll see that it is a plan that solves the problem, makes sure there is no such thing as an uninsured American, and does it without kicking anybody off the plan that they have. This idea that the union members don't know what's good for them is the exact kind of condescension and arrogance that makes people skeptical of the policies we've been putting forward. Here we have a plan that the majority of Americans support. Do you realize how historic that is? That the American people are ready in a way far beyond what was true even 10 years ago and what was available to President Obama at the time. There's a powerful American majority ready to undertake the biggest, most progressive reform we've had in healthcare in 50 years, just so long as we don't force it on anybody. What is wrong with that?
All right,
Can I respond to that?
let me go, Senator Klobuchar.
Just, dude, you just soft talk random shit. Just connect words and try to polish your words and come across as you are being super smart. What the fuck are you talking about? That's the whole Obama plan, giving public option and let people choose. You're not coming up with any new plan, with any new progressive plan in 50 years. Sure, there might be few pointers here and there which might be improved than Obamacare, but yeah, you don't have any good substantial plan.
And then I'll have you explain.
Okay.
All right, Senator Klobuchar. Well, I think the Post-it note came first, Senator. I don't know. I do think the Post-it note came
I must say I take personal offense since Post-it notes were invented in my state. So.
Another cheesy line.
3M.
Okay. So my plan is a public option. And according to all the studies out there, it would reduce premiums for 12 million people immediately. It would expand coverage for about that same number. It is a significant thing. It is what Barack Obama wanted to do from the very beginning. And
which is what he did. What? Are you crazy? That's the public option is what Affordable Care Act is.
The way I look at it, since we're in Vegas, when it comes to your plan, Elizabeth, and Bernie's on Medicare for All, you don't put your money on a number that's not even on the wheel. And why is Medicare for All not on the wheel? Why is it not on the wheel? Because 2/3 of the Democratic senators are not even on that bill. Because a bunch of the new House members that got elected see the problems with blowing up the Affordable Care Act. They see it right in front of them. And the truth is that when you see some troubled waters, you don't blow up a bridge, you build one. And so we need to improve the Affordable Care Act.
Okay, first of all, you may be right that 2/3 of the Democrats are not on board with the plan, but the question is why? Why are 2/3 of the Democrats don't want healthcare for all? Because they are funded by the same companies who are donating to your campaign. So saying that 2/3 of the Democrats don't want, that's why it's not a good plan, is such an idiotic statement. What about the 2/3 of the country? How many people do want healthcare for all? Go and ask even Republicans. You will find majority of the Republicans want healthcare for all or Medicare for all. So, yeah, that's a very shallow statement.
Now blow it up.
Let me just.
You name check 3 of them. Let me get Senator Sanders in
attacked you
there. You
occasionally.
were.
Okay.
Go ahead, Senator Sanders. Okay. We'll get you in, Miss.
All right.
We got a lot of people in here that we got hit.
It's my turn, yeah?
Yes, sir.
Okay. Somehow or another, Canada can provide universal health care to all their people at half the cost. UK can do it, France can do it, Germany can do it, all of Europe can do it. Gee whiz, somehow or another, we are the only major country on earth that can't do it. Why is that? And I'll tell you why. It's because last year, the healthcare industry made $100 billion in profits. Pharmaceutical industry, top 6 companies, $69 billion in profit. And those CEOs are contributing to Pete's campaign and other campaigns. So maybe it is finally time that we said as a nation, enough is enough. The function of a rational healthcare system is not to make the pharmaceutical industry and the drug companies rich. It is to provide healthcare to all people as a human right, not a privilege.
Mr. Vice President,
no premiums, no
Mr. Vice President,
no deductibles.
Let's go ahead. And then Senator Warren. Mr. Vice President.
Damn, and I'm glad Bernie is hitting on Pete Buttigieg because, you know, he sort of have this argument that we should bring people together. Yeah, okay, bring people together, but stand for something. If you are saying I stand for this policy no matter who fund me, then yeah, that's a more respectful stand. Rather than, oh, I gotta bring people together, and the second they start funding me, I'm gonna flip-flop. I'm gonna pitch and pivot in whatever they want. You know, just bending over backwards. And that's what Pete Buttigieg is doing.
And Senator Warren.
Hey, I'm the only one on this stage that actually got anything done on health care. Okay? I'm the guy the president turned to and said, go get the votes for Obamacare. And I noticed what everybody's talking about is the plan.
Dude, Obama already had House and Senate, and still you guys passed such a weak healthcare plan. I don't know, you're taking credit for that. Well,
plan that I first introduced. That is to go and add to Obamacare, provide a public option, a Medicare-like option. It cost and increase the subsidies. It cost a lot of money. It cost $750 billion over 10 years. But I pay for it by making sure that Mike and other people pay at the same tax rate their secretary pays at. That's how we get it paid, number one. Number two.
okay, which is actually shooting on his own foot. Same tax rate as his secretary pays at. What's the difference between the income of Mike's Bloomberg secretary and his?
You know, from the moment we passed that signature legislation, Mike called it a disgrace, number one. Number two, Trump decided to get rid of it. And number three, my friends here came up with another plan. But they don't tell you. When you ask Bernie how much it cost, the last time he said that, I think it was on your show, he said, we'll find out. We'll find out how, or something to that effect. It cost over $35 trillion.
Right.
Let's get real.
Senator Warren, you get the final word on this. We're going to move to another question. Go ahead, Senator Warren. Go ahead, Senator Warren.
So I actually...
Bernie just said, like, and your plan costs $50 trillion for 10 years. I don't know what Biden said. You know, it's kind of hard to hear him.
So I actually took a look at the plans that are posted. Mayor Buttigieg, there are 4 expenses that families pay, right? Premiums, deductibles, copays, and uncovered medical expenses. Mayor Buttigieg says he will put a cap only on the premiums, and that means families are going to pick up the rest of the cost. Amy, I looked online at your plan. It's 2 paragraphs. Families are suffering, and they need a plan. You can't simply stand here and trash an idea to give health care coverage to everyone without having a realistic plan of your own. And if you're not going to own up to the fact either that you don't have a plan or that your plan is going to leave people without health care coverage, full coverage, then you need to say so. I just want to say on this one, I was in Reno when I met a man who said he had diabetes. He gets his insulin through the VA. But his sister and his daughter also have diabetes. No way to pay for their insulin. 3 human beings right here in Nevada
My plan
who
takes
are
care of that.
struggling. They share one
Very quickly.
insulin prescription.
Mayor Bloomberg, was Vice President Biden right? You weren't a fan of Obamacare?
I am a fan of Obamacare. At the beginning,
Mr. Mayor.
Mr. Vice President, I just checked the record because you'd said one time that I was not. In 2009, I testified and gave a speech before the mayor's conference in Washington, advocating it and trying to get all the mayors to sign on. And I think at that time I wrote an article praising Obamacare. It was either in the New York Post or the Daily News. So the facts are I was there. Let me finish. Thank you. I was in favor of it. I thought it didn't go as far as we should. What Trump has done to this is a disgrace. The first thing we've got to do is get the White House and bring back those things that were left, and then find a ways to expand it. Another public option, to having some rules about capping charges. All of those things. We shouldn't just walk away and start something that is totally new, untried.
Vice President Biden, go ahead.
It's not totally true or untried. It's already tried and tested by other countries. What is your argument? You're saying totally true and untried? Well, I mean, you know, if you go 10 years back, Obamacare was kind of sort of untried because it was tried in only few states. So when Obama expanded it to the whole country, whole people, like most of the right-wingers, they went crazy. And you talk, if you're pointing it to the Bernie's Medicare for All, it's already tried and tested in other countries, and you can see the results. If you choose to look at the figures and if you choose to really take a good look at what country needs.
Mayor said when we passed it, the signature piece of this administration, it's a disgrace. They're the exact words. It was a disgrace. Look it up. Check it out. It was a disgrace.
Thank you.
I cover, by the way, I plan. You do not have surprise billing. You bring down drug prices. People are not, it gives people all the things we're just talking about. I guess you're not got enough time to do it, but I'll get a chance to talk about it.
Thank you, sir. Lester?
All right.